choose consistency over intensity, and aim for functional milestones you can feel in real life, not the magic number on a goniometer. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Hey, welcome back to the Total Knee Success Podcast. I'm Michelle, and today we're talking about something that causes more stress and tends to get more attention than almost anything else after knee replacement, and that's range of motion. For most people, it's one of the biggest goals and sometimes one of the biggest worries during healing. By the end of this episode, you'll be able to picture exactly what 0 degrees, 90 degrees, and 120 degrees look like in real life. Understand how older implants compare with modern designs, and know why the kneecap's glide matters for bending, and have a clear, safe plan for making gains without tipping into inflammation. You'll also hear the truth about common myths, learn when to call your care team, and get a calm, realistic timeline so you can track progress with confidence. Let's set the stage first. When we talk about extension, we're talking about how straight the knee is. 0 degrees is fully straight. When we talk about flexion, we're talking about how far the knee bends. Hitting full extension early helps you walk efficiently without a limp, and reaching about 90 degrees of bend, that's a right angle, by the 6-week mark often lines up with easier transfers and basic daily tasks. Studies have shown that people who meet these motion milestones tend to walk more independently and report higher satisfaction down the road. So what do the numbers really mean in practice? Think of 0 degrees as your smooth stride. When the knee straightens well, your heel strikes the ground cleanly, and your steps feel more natural. Your gait is actually more efficient because in initial contact, when your heel strikes the ground, your knee should be in full extension or 0 degrees. And when you have full weight on that leg and your opposite leg is swinging through, that's called mid-stance, you should also have 0 degrees at that reference knee. So there are 2 times during the gait cycle where you will actually use that 0 degrees, and your gait cycle is more efficient if you have 0 degrees. If you have a slight bend, mechanically, you're not as efficient. Around 90 degrees is the bend you use to sit comfortably in a chair, tie a shoe, or swing a leg into bed. By the time you're near 110 to 120 degrees, you're in the range needed for most household and community activities, getting in and out of a car without twisting, sitting in lower seats, even some light gardening movements. Many modern implants can allow motion past 120 to 125 degrees, but for the vast majority of people, 110 to 120 covers pretty much everything you need in daily life. Large outcome studies suggest there's limited added functional benefit beyond that for most tasks. That doesn't mean don't get the full range. It means don't worry about it in the beginning. A quick bit of context helps here. Years ago, certain implant designs and surgical techniques sometimes yielded flexion arcs closer to 100 to 115 degrees. Thank goodness they've progressed from there. With today's components and soft tissue balancing, it's more common for people to land in the 110 to 120 band. And that doesn't mean everyone will. It depends on a lot of factors, including how much motion you had before your surgery. And it doesn't mean more is always better. It simply means design can remove some barriers, while your steady effort does the rest. Now, let's talk timeline because pacing matters. In the first couple of weeks, swelling is the boss. Fluid in and around the joint limits how far you can bend and how easily you can straighten. This is a time for gentle motion, protecting the incision and letting your body knit the tissue. Forcing aggressive bend early, it really only invites more swelling. As you move into weeks 3 through 6, many people, and I would say most people, approach 90 degrees of flexion while closing in on full extension. Some people do achieve more than that. From 6 to 12 weeks, though, a lot of folks tend to climb into the 110 to 120 degrees. And improvement doesn't necessarily stop there. Research shows motion can keep on inching forward for 6 to 12 months as swelling settles and the strength comes online. A helpful mindset is that the early phase is your foundation, and gentle consistency beats pushing past the body's current limit. Here's a key mechanical insight that often gets overlooked. The patella, or the kneecap, must glide smoothly in its groove for the knee to bend comfortably. If the kneecap is stiff against surrounding tissues, it can feel stuck before you reach your true potential. Light, comfortable patellar glides, taught by your therapist, help restore that slide and glide, making a deeper knee bend more accessible without cranking on the joint. Even though these movements seem simple, they can have a big impact because the kneecap directly influences how smoothly your knee flexes. When it moves freely, the mechanics of the knee line up with how they should be, and the whole joint bends more easily and with less discomfort. Let's translate this into a day you can live with. Begin by managing swelling so motion is possible. Elevation that gets the ankle above the heart when you rest. Compression as advised, and icing at the right moments during the first several weeks. Then layer in frequent, short bouts of motion spread throughout the day. Think of gentle heel slides, seated knee bends and extends you can pause and breathe through, and quiet time and supported extension to encourage that end range straightening. Your therapist may add stretches, progressive strengthening when you're ready, and joint mobilization as the weeks roll by. The theme is steady, progressive input. Intense hero sessions usually backfire by ramping up the fluid and making tomorrow harder. When swelling increases, it doesn't just make the knee look puffy, it changes how the tissues move. The joint capsule becomes tighter. The muscles lose a bit of coordination, and bending feels heavier, almost as if there's internal pressure pushing back, which is literally what's happening. That's why small, steady gains with good swelling control make such a difference. They keep the tissues supple enough for progress without stirring up irritation that limits motion. If that does happen, don't worry. You just keep on working on the swelling and then keep working on the range of motion. This is definitely a marathon. It's not a sprint. So let's clear up a few myths that can generate unnecessary worry. First, there is not a universal rule that you must hit 120 by 6 weeks, though several protocols do include that number. People arrive with different histories, different backgrounds as far as what they dealt with preoperatively. And there are also surgical variables. The aim is function and trend and not a single deadline, so don't hang your hat on one single deadline. Second, not everyone will reach 130 to 140 degrees, and that's okay. Many daily tasks are fully manageable in the 110 to 120 zone. And third, setbacks do happen. Maybe it's a day of extra swelling, a stiff morning, or a plateau that lingers for a bit. Those moments are completely normal and usually improve with steady, gentle effort. In a small percentage of people, about 2 to 5%, the knee may stay unusually tight, despite consistent stretching and therapy. And in those cases, your surgical and rehab teams have additional options to help, including a brief procedure called a manipulation under anesthesia, otherwise known as MUA. And it sounds intimidating, but it's generally short and safe and can help regain motion when progress has truly plateaued. Most people never need it, but it's reassuring to know it exists if stiffness becomes a barrier. So talk to your surgeon about that if knee bend is something you're really struggling with. People I've worked with often describe the same kinds of challenges: getting into the car, sitting comfortably at a restaurant, or finding an easy position at the kitchen table. Instead of forcing a deep bend all at once, we focus on short, frequent bending sessions, keeping swelling under control, and adding a few minutes of patellar glides as their therapist teaches. Over time, these small, steady efforts make daily movement smoother and more natural without creating extra irritation. If you're looking for safe ways to keep motion improving, talk with your physical therapist about a few simple activities. For extension, gentle overpressure can help the knee finish straightening. Things like resting your ankle on a small prop, letting gravity assist a little bit, or even lying on your stomach with a folded towel just above the kneecap so there's no pressure directly on it while the leg dangles off the edge of a surface for a short time, maybe the end of your bed. For flexion, you might use an assisted heel slide on the bed or on the couch. It might be a challenge to get on the floor at this point. Using a towel behind the knee or a strap around the foot, you can gently guide the bend comfortably, or sit in a sturdy chair, plant your foot, and gently scoot forward until you feel a mild stretch. Hold there, and then gently scoot forward again. This way, you can coax the knee into bending more. These moves should stay controlled and never forced, always guided by your therapist's recommendations for your particular case. Here's the recap, nice and simple. 0 degrees straightening supports efficient walking. 90 degrees unlocks basic sitting and self-care. 110 to 120 covers most daily tasks. Respect the early healing window so swelling doesn't drive the bus. Keep the kneecap gliding to help the bend. Choose consistency over intensity, and aim for functional milestones you can feel in real life, not the magic number on a goniometer. Speaking of that word, what exactly is a goniometer? It's that metal or plastic tool, usually plastic, the old ones are metal, that your therapist uses to measure how much your knee bends or straightens. It looks a bit like a protractor with arms that line up along your thigh and lower leg. The number it gives in degrees helps track your progress over time. Because people's leg shapes and positioning can vary slightly, and because therapists are different from each other, 2 different therapists might record a few degrees difference on the same knee, and even the same therapist might measure a little differently from day to day. Studies show that this normal measurement wiggle room called intra- and inter-rater reliability, it's actually the other way. Inter is what I described for first, and intra-rater reliability is usually about 3 to 5 degrees either way. In simple terms, if your therapist tells you you're at 95, that might really mean somewhere between about 90 and 100 degrees, and that's totally normal. The important part is the trend over time, not the exact single number. And this number can even vary within the same session. So don't worry too much about that exact number. Think more about the trend and taking care of your knee and making sure that it's gentle, gradual progress. So before we wrap up, a quick safety checklist. Reach out to your surgeon or therapist if you notice a loss of motion you previously had, a sudden hard block to bending or straightening, redness, warmth, or drainage at the incision, or a sense of instability or giving way. Those are red flags worth a prompt conversation with your team. And remember, this is all general education. Your own plan should follow your provider's guidance. For more information and helpful guidance about healing after knee replacement, visit totalkneesuccess.com. Next time, we'll focus on something that challenges a lot of people after surgery, and that's going up and down stairs. We'll talk about which muscles do the work, how to build strength and control for each step, and the safest way to practice at home without too much fear or frustration. You'll learn when to lead with your surgical leg, when not to, and how to transition to reciprocal stair climbing confidently and safely. Thanks for spending time with me. Keep the inputs gentle and steady, celebrate those small wins, and I'll see you in episode 14. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.